From safari adventures and travel updates to conservation and humanitarian stories, this is Africa Revealed, bringing you the heart and soul of East Africa. Now, here's your host, Dr. Matt Jensen.
Hey everybody, welcome back again to Africa Revealed with Dr. Matt Jensen. Thanks for joining us today. I'm excited for you to join the continued conversation that we're having with the great Geofrey Okeny of Northern Uganda. If you didn't listen to the previous episode, I invite you to do so. He gives us a little glimpse into what life is like in rural Uganda, in the villages, far, far away from any safari route, far, far away from any other Western involvement, but into his village and what it's like to grow up as a child in these little areas and the wonderful people that live there. Well, today we're going to jump into now what brought Jeff and I together and the humanitarian work that we're doing. And there's a lot of exciting things happening, but there's still a great need. And I hope to our listeners that are following along today that their hearts will be warmed with the good work that we're doing, but that they'll look at things a little bit different and that we'll invite them to get involved, whether it be in their own community, whether it be supporting our projects or even volunteering. Wouldn't it be great, Jeff, if one of our listeners from this episode reached out to us and said, I want to come to Uganda, I want to meet Geofrey, and I want to work and see his villages. Who knows? We'll see if that happens. But thanks for joining us once again, Jeff. It's great to have you on this second or part B episode of Hope in Uganda.
Thank you very much, Dr. Jensen Matthew, and thank you very much, our listeners, for following this amazing podcast and stories about Africa and our humanitarian works that we are doing. It's such a great privilege to be on this podcast. Thank you, Matt.
Thanks, Jeff. Great to have you back again. And I kind of glossed over in the previous episode how Jeff and I met. It's kind of a funny story, but it was definitely one of those things that was meant to be. But I'll fast forward a little bit where I was able to get to Uganda the first time to meet this Geofrey Okeny in person and really see what was going on. And let me tell you, I'd already been to Africa a few times and we'd already started our work. But let me tell you what I found in Geofrey and in what he's doing. I found another inspirational push inside me to get involved and to continue on with this great humanitarian work that we are trying to build and grow. Well, I showed up at the airport in Entebbe, and Geofrey and our driver, Emmy, picked me up, and off we drove 7 hours up to northern Uganda. We're hoping to get regular classes of air up to a nearby city, up to where we work. It's not there yet, but it's a long way. You pass over the Nile River, you go up to the northern area of Uganda, close to the South Sudan border, to the towns of Gulu, Kitgum, and into Geofrey's home village, Okwichi Village. Well, when Jeff and I arrived into Gulu, which is the home of his practice and the dental school, we had lined up to just do a small outreach dental clinic that day. And we went first to his office. He showed me his dental office, and I got to treat a patient in his office. And then I believe it was the next day we had a dental camp. And again, the wonderful thing that Geofrey has done, one of the solutions that he's been able to provide is twofold. He works at the dental school, so he's able to bring the dental students to get more experience. And by doing that, he's able to treat more people. And so each weekend, he rotates amongst the different villages. And some villages might see him once every 6 months. Some villages might see him once a year. But nonetheless, there is hope that's building. In fact, Oral Health Uganda, Jeff's organization that we partner with at Dental Outreach Relief Foundations, their motto is the dawn of new hope. And so Geofrey is doing that. And we are now partnering to bring greater relief and greater help to the people in these villages. Well, as we showed up that next day to work in truly the first dental camp that I'd been in Uganda, we went into a school building with no glass windows, no doors, no electricity. We simply used it for shade and shelter. We brought all the dental equipment with us. We brought all the hand instruments. We brought a generator for the meager power that it would supply so that we could have some degree of handpieces and other needed equipment that we needed. But But for those of you who go to the dentist, and I'm not trying to make this a dental episode as much as I'm trying to make it a humanitarian episode, but for those of you who know what it's like to be in a Western dental clinic, this is what we were treating the clients with. Yes, we did have some portable dental units where we could do, and we continue to do some filling work. But the needs of these people are so much greater than just routine fillings. Many of these people are living with pain, they're living with infection, and they simply can't get relief from it. And so much of our time is spent removing and extracting diseased, decayed, and infected teeth and relieving pain and infection. There is no water syringe that the dentist gives you a nice, refreshing spray of water to rinse your mouth out. No. There's no suction straw to evacuate all of that stuff in your mouth. No. When the mouth fills with saliva or debris, they simply lean over and they spit out into a makeshift trash receptacle. We sit back, we dry the mouth as best we can with cotton and gauze, and we continue to work. Now, you may think that's pretty crude. You may think that that's pretty difficult, and it might not sound so fun. But let me tell you, the people that we visit that have been living with infection, living with pain for months or years are so thankful. And the gratitude that they show after is one of the most moving parts. It's almost, Jeff, now that I want to bring Jeff into this, but Geoffrey, it's almost like there's not a lot of thanks and hugs. It's more like they're quiet and they're stoic almost. And Jeff has told me that this is part of their way that they show respect and that they show reverence to the service that they've waited so long to get. Right, Jeff? So let's go back. Geoffrey, tell us about the struggles that these people have with basic dental and medical care.
Just as Matt put it, is that healthcare in Uganda is something that is still very low, and most people do not have access to the most basic care that you can think about. So, meeting Dr. Matt Jensen has actually helped me reach out to more people. And with the communities that we go to, there is literally no healthcare setting. So people survive by the bare minimum. So you will not find any hospital near, and if you find one, then it is miles and miles away. So with the humanitarian work that I do and Matt Jensen does, when we take these services to these people in the villages, many of them actually find this as very, very relieving, because they have to, when they come to us and then we provide this care, it's like a big savior to them, because they will not have to look for this care anywhere else. And even if they try, they'll have to move very, very far away to get this care. So in scenarios where we have been going and reaching out to these communities, we find so many people, and we literally can't finish them all, but then we do what we can. And on several occasions, even when I was with Matt, there are situations where people would come, and then Matt is like, what can we do? What can we do? The people are so many, we don't have the time, it's already getting dark. I remember there was a time when we actually worked till dark, and that just shows how much this care is needed. The people need this care. So if we don't do it, if I don't go there to do it, well, who will? So that's why we keep on doing this more and more and more. So the need is really very big. Initially, we started with dentistry and dental care, and so far we have reached thousands and treated so many people. And you will be surprised that someone in their entire lifetime has never ever seen a dentist. Never ever. Not just a glance. They have never glanced at a dentist, and this is really so sad. You'll find kids with a lot of swellings. You'll find people with a lot of dental complications from untreated caries, that they just have to live with it in the communities. So I couldn't just sit back and watch because I could do something about it. So that's why I keep on going and keep on doing this. And when I met Matt, Matt has been very influential and very important to me in this cause because he has helped me actually do it more. So thank you very much, Matt, and all our listeners out there. I am very grateful for this meeting.
Just to give our listeners a little idea, in the United States, we have one dentist for about every 1,700 people. And, in small towns, it's less than that. In big cities, it might be more than that. But safe to say, most people in the United States can get to a dentist within 30 minutes, definitely within an hour, and most within less than that. One in every 1,700. In Uganda, there's one dentist for about every 100,000 people. But if you remove the larger cities like Kampala from that, Kampala is the capital city. In fact, nearly 40% of all dentists are within that city, right? Nearly half. There's actually one in every 200,000 to 500,000 people. Think about that. Think about that. Areas and communities of 2 to 300,000 people with no dentist. Now, I hope that gives our listeners a little bit of understanding when it comes to just how lucky we are. Jeff, it's a big joke in the United States. People love to jokingly complain they hate going to the dentist. They hate going to the dentist. But it's because they have it so often and are able to get so often that they're able to focus on the pain of going to the dentist. They don't necessarily have to focus on the pain of not being able to go to the dentist. And that's what the people of Uganda and other areas of Africa in rural areas. So now I want to switch gears for a minute, Jeff, and let's talk about really what this whole thing is about, and that's bringing hope to Uganda. Our listeners have already been able to hear how we're trying to bring hope to Uganda and Kenya, other areas, by when people book safaris, when they're aware of Tapestry of Africa, we bring, and Geoffrey can be the first one to tell you that once our safari company got it starting a couple of years ago, the fundraising just went up, didn't it, Geoffrey? And now, so Jeff, a couple of years ago, we're talking, we said, how can we, it's like we're trying to hold sand with our fingers held wide open. The sand just kept falling between our fingers. We just were trying to hold on to getting so much good done, but we just felt like it was slipping away. So we said, and Geoffrey said, you know what, if we could build a facility out here, a facility would serve a community for hours away, hours away. People will walk without blinking. They'll walk 1 or 2 hours to get dental care. It's hard for them to walk all day and to leave their food and their job, but they will walk an hour or two. So I said, well, Jeff, where would we build this facility? And of course, he says, we have family land. And so after some talking and after some discussion with his family, Jeff's family donated a plot of land so that we could begin to build the Okeny Outreach Relief Community Center. And we're going to put up some photos, but it was about a year and a half ago that we broke ground. We laid the foundation and footings, and I'm proud to say that the roof is in place, the plumbing is in place, the well has been dug, and we are making rapid progress. And we hope this fall, even though it won't be completely finished, that we can have our grand opening of the Okeny Outreach Relief Community Center and do our first community dental project in our new center. Jeff, can you talk about what this new community center is going to do for the community of Okeny and all of the Kitgum area?
So this project of the community health center is going to actually be a big transformation in healthcare, not only to my community, not only to my village, but even neighboring communities that surround my village. Now, initially, when we were starting this podcast, Matt said people move very long distances to access care. And now we are building a one-stop facility where people can walk from wherever they can and then get care from that place. So this place is not going to only be a dental facility. because initially when we were doing some benchmarking with our community leaders, we asked them a simple question. We were like, what do you think would be some of the most urgent care that you feel we should have in this community? And the answer was maternal care. So we are going to have maternal care, we're going to have medical services, we're going to have dental care, all in this facility. This means a very big transformation, a very big beacon of hope to this community and then the surrounding communities. So they will actually have this care right at their village, and they are very excited about it. They are very happy. I was there last week, and we were digging the well, and some members of the community came and they were very happy. Others actually wanted to actually give a personal testimonial to Dr. Matt, saying thank you for the well, because they don't have safe drinking water. So this well that we dug is going to actually help even the community supply safe drinking water. They are very, very excited. Just as Matt put it, is these communities actually, if people like me, people like Matt, if people who are into this humanitarian work do not show up, they don't have the hope. No one will do it for them. So this community healthcare clinic that is being placed in Okwiji village where I was born, um, it makes me so happy and excited. Each time when I go to my village, and then I'm like, okay, I do this for people. I've been going to different villages providing care, and now my very own are also receiving this care. It makes me so happy. So I'm very, very happy about that community health center that is coming up. I know it's still a long way to go. We still have to complete it. We need to put a fence over the place. We need to build staff quarters and guest houses for our volunteers that come and are able to provide service at that place. We need electricity, that is solar energy, to supply the place. So it's still a lot of work. We need the equipment that will run the place. We need the manpower, the people that will run the place. So it's actually a very big project, but a dream come true to me, because I'm seeing it unfold right before my eyes from the time when Matt was like, okay, I think we can start on the foundation. I literally jumped from my chair. I'm like, yes, this is it. And I've seen it unfold. I've seen the foundation come. I've seen the walls raised. I've seen the roof structure come. I've seen the electrical work done. I've seen the plumbing work done. And it's a big, big, big dream coming true. And this place is going to be a massive beacon of hope to this community and my village and the surrounding villages.
It's amazing, Geoffrey, and I get so excited. In fact, I'll be back with Geoffrey in about 2 weeks as I head back to East Africa for another round of safaris and checking on our humanitarian work. And we will create some videos. We'll create some episodes for social media so you can all see the updates that's been happening over there. And yes, one of the milestones we just reached was the digging of the well to bring fresh water. In fact, not just for the clinic, but a separate plumbing structure so that the community can get fresh water. It is such a rewarding project to be a part of. And Jeff, I'm just so thankful that we met, because you bring the heart and the spirit of the project. Our clients that go on safari are helping with the funding. Some people might ask, Jeff, well, how can I help? That sounds like an amazing project. I want to tell our listeners 100% of all donations go to the project. You know, there's many charities and they do good work, and I'm not here to make any kind of complaint, but we don't have a brick and mortar foundation building. We don't have a full-time staff. We are all volunteers working on our own. So when somebody donates $500, That's $500 that we send to Uganda, to the builders, to the materials to help to build the facility. So people listening might say, well, how do I get involved? Or what's an easy? There are 3 ways you can get involved. In the show notes, if you're listening by Apple or Spotify, that I hope you'll look at the show notes, because I want you to remember these websites and resources. The first way you can get involved is to make a donation. Very easy. We are a registered 501c3 entity in the United States. That means 100% of your donation is completely tax deductible. You can go to dentaloutreachrelieffoundation.com. Up in the right-hand corner, there's a donate button, very simple donate button. You can pay by credit card, many other ways. You can send a check to the address listed on our website. I'm the only one that gets that money, okay? I'm the one. It doesn't go to a committee. It goes to a special bank account that is set aside for this work. And then this money gets paid directly to Uganda or to Kenya, because we have projects in Kenya, but 100% to the villages and projects we're involved in. So that's the first way. The second way you can get involved in is sign up to be a volunteer. Sign up to be a volunteer at the same website, dentaloutreachrelieffoundation.com. You can go to our volunteer sections. There's a volunteer application. There's past mission trips. There's upcoming mission trips. And you can see what we have on the horizon. If you decide to come to Uganda, you're going to get to see part of that building. In fact, very exciting. If you come and you are a partner, if you come and build with us, if you come and volunteer with us, your name will go on a plaque on that building that recognizes every volunteer that helped to build the facility. If you donated to the facility, your name will go on the plaque. So there will be a part of you left in Uganda for helping us with this amazing work. That's the second way. Oh, and by the way, I just want to say, if you choose to volunteer, people ask, well, I'm not a dentist. I've never worked in a dental office. It doesn't matter. There is a place for an open heart and helping hands. You might not work directly in the dental clinic. You might work in the schools, helping the kids learn English. You might work with the children playing games. You might work with some of the women's groups to teach them self-efficiency, self-sufficiency, and other ways in which you can give of your time, knowledge, and talents. Even though it's Dental Outreach Relief Foundation, we outreach many areas of these communities. What's the third way that you can help support our cause? Book a safari with one of our companies, tapestryofafrica.com or luxurySafariCo.com. Both of these companies support the work that we're doing. I had a wonderful career as a dentist. I had several practices, and about 3 years ago, after our foundation really started to take off, I sold my practices. I am all in on Dental Outreach Relief Foundation and the safari work that we so love, that is such an enjoyable, inspiring way to give to the people of East Africa. You see, when you book a safari, and by the way, I'm going to go off script here for a minute, because whether you book a safari with our company, whether you book a safari with a different company, you are supporting the people that need it. You are supporting the safari guides. You're supporting the activity providers. These people need financial support, and the best way to do it is through supporting their work, their business, by coming on a safari. And when the added bonus is, if you're able to book a safari with one of our companies, you are helping directly support this great work. So Jeff, it's been he's my brother. I should start calling him my son, but it really is a brotherhood that binds us for this great humanitarian work. Thanks for joining us today, Jeff.
Thank you very much, Dr. Matt Jensen, and thank you very much, our listeners. I have been really very happy to be in this podcast. It has changed my life in some way. And it has also been nice to listen to Matt talk all these things. I love listening to him talk.
And if you want to hear more from Jeff, if you want to find out more about what's going on with the humanitarian work, follow us and subscribe on our social media channels, Facebook, Instagram, TikTok, YouTube. Also, follow us on our Safari social media platforms, because we also bring more about the people, the experiences. It's all different ways that you can see and feel and experience the magic of the people, the wildlife, and the culture of East Africa. Thanks for joining us today. We appreciate your patronage. We hope you'll continue to follow us. Put a question for me, put a comment in the podcast episode that you're listening to. I love to read these questions and comments. I want to answer them in future episodes. But thanks once again for joining us here on Africa Revealed. We'll see you next time.
Thanks for listening to Africa Revealed. Join us again next week as we uncover more of the wildlife, wonder, and stories that make Africa unforgettable. Until then, adventure awaits.